Budget tensions continue in North Carolina as lawmakers clash over Medicaid funding and ongoing budget negotiations, all while the federal government remains shut down. You're watching the Matthews Area Chamber Advocacy Update, sponsored by Atrium Health. I'm Sarah Principe, and it's October 27th, 2025. State lawmakers are still divided on how to handle the Medicaid rebase, a funding gap that led the Stein administration to cut reimbursement rates for some healthcare providers. This issue is a little technical and comes with a lot of big numbers, but here's the short version. It's creating financial pressure for hospitals and clinics across the state, and it could have broader implications for the cost of healthcare if it isn't resolved soon. Last week, the House passed two bills aimed at closing that gap. House Bill 491 would let the Department of Health and Human Services use $190 million from Medicaid reserves on a one-time basis. Senate Bill 405 would add another $90 million in general fund support and $83.6 million from other sources for Medicaid-related costs. Both passed the House unanimously, but are unlikely to move in the Senate. Senate leaders said their proposal, which included funding for a proposed children's hospital in Wake County, was rejected by the House. The disagreement has added to the ongoing budget stalemate, leaving healthcare providers and state officials uncertain about how and when the shortfall will be resolved. Lawmakers did, however, approve Senate Bill 449, which includes additional hurricane recovery funding and updates to workforce-related education programs. The bill revises the funding formula for cooperative, innovative high schools, increasing allocations for schools in economically distressed counties, and raises tuition for non-resident students at NC Promise universities beginning in 2026. These changes are intended to strengthen access to workforce pathways while maintaining affordability for in-state students. Child care providers are also continuing to press lawmakers for $145 million in recurring funding to stabilize programs and prevent closures. More than 500 owners and directors signed a letter urging the General Assembly to create a statewide subsidy floor, setting a minimum reimbursement rate for centers that participate in the subsidy program. Advocates say this would help sustain operations in rural areas, improve teacher pay, and ensure quality care for working families. Without additional investment, they warn that more centers could close, further straining the workforce and disrupting families across the state. The General Assembly is scheduled to reconvene on Monday, November 17th, when additional budget discussions could resume. At the federal level, the government remains in a partial shutdown after Congress failed to pass a spending agreement by October 1st. While essential programs like Medicare and Medicaid continue, other services have been delayed or suspended, and there's growing uncertainty around SNAP and other federal benefits heading into November. The prolonged shutdown is adding another layer of strain for families, businesses, and local governments that depend on federal support. Until next time, I'm Sarah Principe, and this has been the Matthews Area Chamber Advocacy Update, sponsored by Atrium Health.